Have you ever paused to consider the silent battles happening within your own body? The ones no one sees, but that define the very essence of your health and vitality? Imagine for a moment the delicate rhythm of your kidneys, tirelessly filtering, balancing, and sustaining life in ways we often take for granted. For those living with chronic kidney disease, this rhythm is already fragile, a precarious dance where even the smallest disruption can have profound consequences. Infections, which many perceive as brief or insignificant interruptions, carry a hidden power, an invisible force capable of altering the trajectory of your health forever. It is easy to underestimate the impact of a short fever or a fleeting urinary tract infection, thinking, it's just temporary, it will pass. Yet beneath the surface, a storm quietly brews. Inflammatory responses triggered by these infections can suffocate the delicate renal tissue, while changes in blood flow deprive the kidneys of vital nourishment. Each episode, however minor it may appear, leaves an imprint, a subtle scar that accumulates over time, threatening to unravel the intricate balance that sustains life. Understanding this invisible war is not meant to incite fear, but to awaken awareness, to ignite a conscious commitment to protecting one of the body's most vital organs. Dr. Mathew R. Weir teaches that true health emerges not only from treatment after damage has occurred, but from the vigilant, proactive care we give ourselves before crises strike. This philosophy is deeply relevant for anyone with CKD, for whom knowledge and timely action are shields against irreversible harm. There is a rhythm to prevention, a sequence of mindful choices, recognizing the early signs of infection, seeking prompt medical care, maintaining proper hydration, and nurturing the immune system through both diet and lifestyle. Each step may seem small in isolation, yet when compounded over weeks, months, and years, these deliberate actions form a bulwark against the relentless tide of kidney deterioration. Consider the interconnectedness of your body, how a fever in one moment, a brief infection in another, can ripple outward, challenging your kidneys to compensate, to endure, and sometimes to fail. The suspense lies not in a sudden collapse, but in the quiet, imperceptible damage that creeps forward unnoticed, demanding vigilance at every turn. Yet within this reality lies profound opportunity, the chance to reclaim control, to honor your body through informed choices and unwavering attention. For those who embrace this path, awareness becomes empowerment, anxiety transforms into action, and the looming threat of permanent kidney damage is met not with helplessness, but with strategy, care, and respect. Dr. Mathew R. Weir emphasizes that education is not merely the acquisition of facts. It is a lifeline, a guide toward understanding how each decision, each moment of inattention, carries weight. With every medical appointment kept, every symptom noted, and every precaution observed, you invest not only in the survival of your kidneys, but in the richness and continuity of your life. Picture the kidneys as twin sentinels, filtering toxins, balancing fluids, and orchestrating the harmony of countless biochemical processes. When infections strike, these sentinels do not simply pause. They labor harder, their workload amplified by inflammation and compromised blood flow. The tension builds quietly, often without symptoms noticeable to the individual, creating suspense in the silent corridors of the body, where damage can accumulate unnoticed. It is in these hidden struggles that knowledge becomes invaluable. By embracing the teachings of Dr. Mathew R. Weir, patients and caregivers alike can cultivate a mindset that transforms passive awareness into active protection, turning the invisible threat of infection into a call for vigilance, empathy, and deliberate care. Understanding the profound impact of brief infections, the subtle yet relentless harm they can inflict, equips each person with the power to intervene early, to safeguard kidney function, and to cultivate a life defined not by limitation, but by informed resilience and unwavering self-respect. Life has a way of testing our resilience, often in ways that are invisible, subtle, and relentless. In the world of chronic kidney disease, these tests come not as dramatic moments of collapse, but as quiet, creeping challenges that accumulate silently, almost imperceptibly, until the consequences can no longer be ignored. Infections, no matter how brief or mild they seem, act as hidden saboteurs, infiltrating a system already burdened by fragility and compromise. The body's response, while designed to protect, can paradoxically become a source of harm. Inflammation surges, blood vessels constrict, and the delicate renal tissue strains under the unseen weight of these processes. The suspense in this reality is not theatrical. It is profound and relentless, residing in the uncertainty of whether the next fever, the next minor infection, will be the one that pushes the kidneys beyond recovery. Yet within this tension lies a powerful lesson, one that Dr. Mathew R. Weir underscores in his teachings. Life's fragility is not a reason for despair, but a call to heightened awareness, to intentional living, and to deliberate care for the body that sustains us. Every action matters. The decision to seek prompt medical attention at the first hint of infection, the vigilance in monitoring symptoms, the discipline of maintaining proper hydration and nutrition, the commitment to preventive practices that strengthen the immune system. Each of these choices may feel mundane, almost invisible, but collectively they serve as shields, fortifying the kidneys against the invisible storm that infections can bring. Imagine the kidneys as two tireless guardians, working ceaselessly to filter, balance, and cleanse. When infections arise, these guardians are forced into overdrive, their resilience tested beyond ordinary limits. Blood flow may slow, toxins may accumulate, and the silent damage may begin before anyone realizes it. This is the tension, the suspense, that underscores the seriousness of infections in CKD patients. The damage is quiet, cumulative, and often avoidable through timely intervention. It is a paradox of life that the very processes designed to protect us can also harm us if not carefully managed. And understanding this is the first step toward empowerment. Dr. Mathew R. Weir emphasizes that education, mindfulness, and proactive measures transform vulnerability into strength. By recognizing the hidden dangers of infections, patients gain the ability to act decisively rather than react passively, to safeguard kidney function, and to navigate the uncertainties of chronic illness with courage and clarity. Consider the subtlety of this struggle. A low-grade fever, a brief bout of flu, a urinary tract infection, all seemingly inconsequential events that, if neglected, can compromise years of careful health management. The suspense lies in the unknown. When will the next disruption occur? And will it be the one that leaves lasting harm? Yet suspense is not solely a source of fear. It is also a catalyst for action, compelling us to remain vigilant, to respect the fragility of life, and to act with foresight. Within this framework, prevention becomes a form of empowerment, and every measured step taken to protect the kidneys becomes a declaration of self-respect and determination. Dr. Mathew R. Weir teaches that awareness is not passive knowledge. It is an active force that shapes outcomes. The more we understand the interplay between infections and kidney health, the more capable we become of safeguarding the life within us. Each medical appointment kept, each symptom noted, each precaution observed, transforms uncertainty into control, and risk into a strategic effort to maintain well-being. The philosophy is simple yet profound. Life is a series of choices, and the preservation of health lies in the accumulation of small, deliberate, and informed actions. The suspense of potential harm serves as a mirror, reflecting the consequences of inaction, while simultaneously illuminating the path of responsibility. In embracing this mindset, inspired by the insights of Dr. Mathew R. Weir, patients can transform fear into empowerment, uncertainty into proactive care, and vulnerability into resilience. Understanding that even brief infections can permanently affect kidney health shifts perspective, turning what may have seemed trivial into a powerful call to action. This awareness, combined with vigilance and timely intervention, allows life to continue, not as a series of compromises, but as a journey guided by knowledge, courage, and self-discipline, reinforcing that every moment and every decision matters profoundly in the preservation of health and the pursuit of well-being. As we journey deeper into understanding the quiet threats that infections pose to kidneys, a profound truth emerges. The greatest battles are often invisible, waged not in dramatic moments, but in the subtle, ongoing rhythms of life that most of us overlook. Chronic kidney disease teaches us that vulnerability is not weakness. It is a signal, a reminder that care, attention, and deliberate action are essential. Infections, even fleeting ones, act as catalysts in this delicate ecosystem, igniting inflammation, disrupting blood flow, and challenging the resilience of organs that work silently to sustain life. The suspense of this reality lies in its unpredictability. No one can foresee exactly when the next infection will strike, nor can anyone guarantee that it will pass without leaving its mark. This uncertainty, however, is not meant to paralyze but to awaken, a call to action, a prompt to cultivate awareness, to observe the body with curiosity, respect, and attentiveness. Dr. Mathew R. Weir teaches that life's most meaningful victories are achieved not by ignoring challenges, but by understanding them deeply and responding with intention. Knowledge becomes a shield, vigilance becomes a weapon, and timely action becomes a form of respect for the life entrusted to us. Consider the power that lies in understanding how infections interact with kidney function. A simple symptom noticed early, a consultation sought promptly, a treatment initiated without delay. Each of these acts is a thread in a protective tapestry that safeguards years of effort, care, and vitality. The suspense, the silent tension of what might happen if these small but crucial steps are neglected, creates urgency and clarity, transforming awareness into empowerment. It reminds us that even brief moments of inattention carry weight, while deliberate, informed choices can prevent irreversible harm. In this philosophical framework, the human body becomes not merely a collection of organs, but a landscape of interconnections, where every choice echoes throughout the system, shaping health, resilience, and potential. The kidneys, these tireless guardians, depend not only on their own strength, but on the attentiveness and wisdom of the person inhabiting the body. When infections occur, they challenge this system profoundly. But through education, mindfulness, and action, the risk of permanent damage can be mitigated. Dr. Mathew R. Weir emphasizes that empowerment comes through understanding, that true care requires both knowledge and action, and that cultivating this approach transforms vulnerability into strength. By embracing this philosophy, patients with CKD, their families, and caregivers can navigate the uncertainty of infections with clarity, courage, and hope. Every step taken toward preventive care, monitoring symptoms, maintaining hydration, adhering to medical guidance, strengthening immunity, is a conscious affirmation of life, a statement that fragility will not dictate outcomes, and that the body's silent battles will be met with vigilance and respect. The suspense that once seemed frightening now becomes a motivating force, a reminder that attention and action are powerful tools in the ongoing struggle to preserve kidney health. In this light, the seemingly mundane aspects of daily care acquire profound significance, each act of awareness and self-protection forming a chain of resilience that defends against the insidious effects of infections. The teachings of Dr. Mathew R. Weir inspire us to see beyond immediate discomfort, to recognize the long-term consequences of neglect, and to approach each day as an opportunity to fortify the body and mind against hidden threats. Life, in its unpredictability, reminds us that vigilance is both a duty and a gift, a bridge between fragility and strength. Understanding that even the shortest infections can have lasting impacts transforms perception, guiding individuals to act with intention, care, and foresight. This approach instills hope, cultivates resilience, and fosters a mindset in which knowledge, awareness, and proactive measures define the journey towards sustained health. And so, as you absorb these insights, consider the responsibility you hold for your own body, the silent guardians within, and the choices that determine whether they thrive or falter. Each moment is an opportunity to act, to protect, to nurture, and to honor life in its most intricate and vital forms. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.